Welcome to the Soul Deep Podcast with Jessica Janty. Join me as we dive deep into raw, real, in-depth conversations about life, love, relationships, sexuality, spirituality, what it is we're really here for, and anything in between. I want this to feel like a safe space for anyone on a spiritual journey, trying to find answers in your truth by having open heart and open-minded conversations. And my hope for you as a listener is that you feel this is a safe space here, a place to hear things from a different perspective that may challenge you and your thinking in the best way possible, allowing you to give grace to how you've been raised or what you've been taught or told to believe. And perhaps you find your truth as I search for mine on this journey we call life. So grab your favorite drink, cozy on up to your couch or wherever you listen from, and join me for these soul deep conversations. All right, welcome back to the podcast. So today I have here with me Dr. Ashley Schrader, family nurse practitioner, and she's also a certified functional medicine practitioner. So I'm really excited that you are here with us today. So thanks for joining.
Me too. Thank you for having me.
Yeah. So before we get too far, I would love to drop into some breath here, some grounding breath before we do any podcasts I love, or any session that I do. I really just love to drop into some breath. So if you are comfortable closing down your eyes, and for listeners at home, if you're comfortable doing that as well, I encourage you to do that. If you're driving, obviously don't close down your eyes, but we're just going to take some intentional breaths in through our nose and out through our mouth. Just keeping this cycle of breath going, this inhale and exhale, really being intentional with how we are slowing down our breath. We often breathe a lot faster than we maybe intend to or even realize that we are doing. So if we can take this power of the pause to slow our bodies down, this is really beneficial for any time of the day. If you are feeling stressed out or tension, just to drop into your breath, just closing down your eyes, being with your body, taking those intentional breaths to slow your breaths down, inhaling and exhaling. This helps us as we focus on our breath to get out of that mind chatter, the external sources that are constantly bombarding us. If we take these moments here just to be with our breath and our body, and we can allow our body's wisdom to come through. We can allow our body to speak to us in ways that maybe that sounds silly to you. You've never experienced that before. But just in taking these couple minutes of breath here, we can connect to our body. We can listen to our body instead of that outside noise chatter. This is really great also. You kind of do a check-in of your body, maybe scanning your body from head to toe, maybe feeling if there's any areas of tension or tightness. And as we think of the area that might be tight or tense, as we focus our attention there, our blood flows there, our breath flows there, can really allow for healing and restoration to that space, just with using our thought, our intention, our breath. We'll just take a couple more breaths here. We'll do one final one together, a deep inhale and a big audible exhale. And then coming back whenever you're ready. Thank you for joining. All right, so I love to also start and just talk about, it's like we're having a cozy conversation, sitting in our kitchen together or on our couch or wherever we are, just having a conversation. So what are you drinking today?
It's a blend of green and mint tea.
I love
Yeah,
tea. Yeah.
I love
It's
mint
such,
tea. It's
yes,
refreshing.
yes.
But I need that little bit of the boost, the caffeine boost from the green tea. And
Yeah. It's that time of year too where it's like you just want something warm and cozy to be drinking. At least for me, I'm always a little bit on the cold side, so I just love something warm. I'm
you,
like constantly getting a warm
same,
beverage. Yeah.
same, all day long
Yeah.
tea.
I didn't ask you, what area are you from?
I am in Oregon right now, but
Mm,
I grew up in Florida and I lived in DC for a very long time and moved out here in the past few years. Yeah.
awesome. Very cool. I've been to Oregon once. It was really gorgeous, and I'd love to go back. My cousin recently, well, it's been about a year now, but she got married out there, and the pictures
Ooh.
just looked so gorgeous. Yeah.
Yeah. It's my first time living in a beautiful place and being
Mm,
connected to nature.
yeah.
Just being able to drive 5 or 10 minutes down the road and get on a trail and hike. And it has been so just wonderful for mental health, to just have that access. It's been such a great shift from living in a big city.
Yeah. Oh, definitely. Yeah. Awesome. Well, if you would love to let our audience know who you are and maybe just a little bit about yourself. So, yeah.
Sure. My name's Ashley. I currently have a functional medicine practice. It's a virtual practice, and I see patients um, who are typically more midlife, a lot of perimenopausal women experiencing issues related to chronic stress. Um, Perimenopause, of course, the hormonal shifts that occur, gut health issues. And the patients that I see right now are mostly in the like in the Washington, D.C. area and Massachusetts. So stress is a huge piece because it's a very much, as you know, as you can imagine, that personality, East Coast type A, work hard, play hard, until like it kind of catches up to you. And yeah, so it's been a wonderful experience. My practice is a year old now. Prior to this, I worked in functional medicine, but it was in a primary care setting as well. We accepted insurance. So it was trying to cram functional medicine into these shorter 20-minute visits, which is really difficult to do, not really the adequate amount of time to really get the right history from patients, to really listen, but also take care of their primary care needs. So it's been wonderful to expand my practice in this way and to a lot for the time necessary to be with folks.
Yeah.
Yeah.
Awesome. So you're a family nurse practitioner. So I'm
Mhm.
assuming you were a nurse practitioner first before you got into the functional medicine piece.
Yeah, so I did a career change. I used to work as a consultant. I was one of those work hard, play hard people, like work 60 hours a week and then drink alcohol on the weekends and throughout my 20s, until I got to a point where it just wasn't sustainable. And I realized this was not like the path that I wanted to go down. And I actually got in a bike accident and ended like in DC when I lived there, bike lanes everywhere. So I biked everywhere for work and just to like do anything. I biked. So somebody opened their door in the bike lane. I flipped over their door and ended up in the emergency room. It wasn't anything. I didn't have like chronic injuries from it, but like a concussion and but the experience being with other being with healthcare providers before I ever considered working in healthcare, and how vulnerable I felt. It was my first time as a patient in our healthcare system, and just feeling safe, even though I was so vulnerable. It was just kind of like, oh, this makes much more sense for me than what I'm doing right now, which is like sitting at a desk consulting. Um, and so from there, I kind of shifted my career and became a nurse, and with the intention of becoming a nurse practitioner. And so my first few years, I was a nurse in the emergency room in DC, grittiest ER in DC, super busy, people waiting for days in the hallways to go up to their rooms. It was like just a unique perspective of like all the worst parts of our healthcare system. Like we really fail to serve the folks that are already underserved, and they end up not getting the preventative care that they need. So they just get really sick. And then that's when, our healthcare system can get pretty good at caring for them. Because they're so chronically ill that they become acutely ill. But it was just like, this is not where I want to be in terms of my role in our healthcare system. So seeing that for years really changed the way that I viewed myself, my role in healthcare. And at the same time, I developed Hashimoto's, that autoimmune hypothyroidism. And so I got to questioning, because of the way that I was kind of treated for that. It was basically like, here's your pill. Bye. We don't care about why. We don't care about like the fact that you have to take a medication for the rest of your life at age 30. And so it got me, thank goodness for, sometimes it can be a good or a bad thing, but this was a good thing in that I discovered functional medicine just through my own research for my personal health. And so that was when I knew. So as a nurse practitioner, I still worked in kind of like the urgent care, primary care setting for a few years, still kind of frustrated with the way the system worked. But then on the side, learning more and more about functional medicine. It was actually a clinic out here in Oregon that was a functional medicine kind of primary care hybrid practice that inspired me to leave DC and start kind of over in this more rural. I'm in Southern Oregon. It's a rural area. There's not a lot of functional medicine out here, but which made it really cool because you're getting to provide this type of care to folks who otherwise wouldn't be able to afford it, using insurance. And so I got to learn so much about functional medicine. I worked there for 5 years and really learned a lot, had great mentors there. But I decided I wanted to kind of go out on my own, do longer visits, really see what I was capable of with more time with folks. And so that's kind of how I ended up here. And so while I was working there as a nurse practitioner, before I switched to this role at my own practice, Rise Functional Medicine, I did this program, the Institute for Functional Medicine. They're kind of like one of the main organizations that offer certification for functional medicine. It's very intense. And usually it takes 5 years and I did it in a year and a half because I was I was kind of postpartum and had some time, a little bit of time on my hands. And so I just really dedicated myself to it and got the certification. And and with that certification being so intensive and learning so much through that, and plus the experience I had in primary care doing functional medicine, I really felt confident enough to kind of go out on my own and start my practice this year. Yeah.
I love that.
Yeah.
And so you had already come to Oregon.
Yeah, I know. It's East Coast. Yeah, I know. I called it Oregon too. Oregon.
So have you ever worked in person where you are now, or it's only been online in the city?
I worked in person. Yeah, it was
That's what drove you
all
there.
in person. Yeah. Yes. So I was doing lots of procedure. I love that. I love being in person too. But I find that you can still really connect with folks virtually. That's not been an issue. Yeah.
That's awesome. Yeah, I do. You can reach so many people in so many different spaces. I think that's what the beauty of virtual is. Like, yes, you can still see people virtually, even if they're in your area, but also you can just reach so many people. So yeah.
Exactly. And for me, I do see kind of a specialized group of folks. And so it's helpful when I'm a little bit specialized. I see a lot of endurance athletes too. And so being able to see folks over a wider geographical area has been really great for the purposes of seeing more of the folks in that population. Yeah.
Super cool. That's awesome.
Yeah.
So what are the typical, you said you see a lot of endurance athletes, but like who typically, like how do how do people find you? How does, because the online space, there's so much out there. So it's like, how do people find you and how does that all work out?
Yeah, it's been an interesting mix. So because I lived in DC for 10 years, I had a pretty great network that was receptive to me kind of opening up. And I was really focused on DC initially because there's such a demand there, and there's not a lot of functional medicine in that area. So I really focused on that. The IFM, the organization through which I got the certification, they have a great directory. And so when people Google like functional medicine provider near me, I pop up through that directory, and there are only a couple of other providers who are certified in that specific area. So a lot of them are coming through there. And through my network, and it's been all word of mouth. Like I really haven't had to do proactive marketing. It's been great to just allow it to happen organically, and that way as well. It seems like I'm getting patients that are perfect fits. Like that through that process, through that word of mouth process, they're the right fit. So that's been wonderful. Yeah.
Word of mouth is always the best. Always.
Yeah.
The best. Yeah.
Yeah, they just come in, they trust you. It's not like they're skeptical. The way my process works is I have an initial strategy session where we spend a half an hour just kind of talking about what's worked, what hasn't, and there's the story of their symptoms. And pretty much it's interesting. I think my website does a pretty good job, but the word of mouth specifically just does a lot of just education before they get to me there, and they really understand kind of what they're getting into by the time they're at that appointment.
Yeah, super cool. Okay, so for anybody listening at home, if they're like, okay, I see a nurse practitioner, or, I've been thinking about different, like, what is the difference between how you saw patients as a nurse practitioner now versus how you see them? You're still a nurse practitioner, but with your, this functional medicine piece as well. So like, what's the difference?
Yes, this is a great question. So as a nurse practitioner, especially in primary care, it was a lot of, okay, let's make sure, all of your acute needs are met, really, like anytime someone gets sick, making sure like acute symptoms, really, that's really where primary care shines, plus screenings, making sure they're getting their mammograms, their colonoscopies, that kind of thing. And then there's some chronic disease management where this is where it really differs. We're putting the Band-Aids on. So, okay, you have high cholesterol. We're really not going to talk about why you have high cholesterol, but we're going to offer up the statin and then move on. And you're just basically going to take this for the rest of your life. And so in my practice, and folks are already mentally there, they're ready to think about things this way, but we want to understand why you have high cholesterol. Usually there's a combination of factors that are contributing to a process like that. I think a really good example too is like depression. It is like the guidelines straight up say, if somebody goes into your office and says you are depressed, you basically, it would be almost a liability if you didn't offer up a antidepressant medication, instead of having the conversation of why, how do we get here? There can be physiologic things that are contributing to that too. Things that are happening in the gut, nutrient deficiencies that directly impact brain health. And so asking those questions, why, is what I have the time to do, especially in my existing practice. And then when we address those underlying issues, we are able to restore function in a way that is sustainable. That's where that word function comes from. The goal is to restore function, and we're doing it in a way where the patient is as empowered as possible, and ideally avoiding supplements or medications long term if we can.
I love that. That was like a huge piece of why I left too. So I'm a nurse by background, and about 3 years ago, I left the hospital setting. I really didn't know how to do what I wanted to do inside of the hospital, inside of healthcare itself, because I just knew I wanted to help people in a different way. And the model that I was seeing was, the area that I was working at the time too, was get people in, get people out. Like it would just felt like we were just like herding cattle, like, let's just get these people in and out and move on to the next one. And it's, do you have this, this, and this? And are your vaccines up to date? And, like, that's the kind of stuff. And it wasn't, like you said, there was nothing about like, well, why are all these people getting sick? Why is this happening more? Why is this happening? Like that was the kind of stuff that was coming up inside of me too. And it's like, I know there's a way, there's got to be another way of healing, rather than us just being so sick and miserable and just continuing on life and just taking a pill and,
It's so true. What we're trying to do, what we're trained to do, right, is put find a nice little box or an algorithm to put people into. And I think that way of thinking also makes us like, it's dehumanizing for the patient. Like we
Yeah,
really, we're
100%.
like, okay, you meet this. Okay. All right. You get a diagnostic label of this, and then now you get this medication. And so over time, especially like what you mentioned, you're just in and out as fast as possible. You really lose that, the whole reason, the why we went into this in the first place, right? Which was to help others. And you lose that, and you feel disempowered as a provider, a healthcare provider too, because you're just completely, your hands are tied. And yeah, it's painful, and it can be traumatizing, I think, for some people too, just as providers to feel like you are so helpless in this system that's just so powerful. And so this is why we have nurses and doctors and nurse practitioners leaving healthcare at crazy rates, and like why suicide rates are extraordinarily high in healthcare providers. It really has to change. It's not sustainable. Yeah.
100%. I love that I just love your journey and how you figured it out. And especially, just you wanted to help. And that's why you became a nurse. And then you became a nurse practitioner. And you're like, wait, there's something more. And then you did the,
Yeah.
functional medicine. Like that's just, yeah, super beautiful. So,
A lot of it was like reframing. Every time I had a new health experience as a patient in our system, and I had really had a new perspective from the patient's view, through my own health journey. Every time it was like a new shift. My mind opened up a little bit more, and it really changed the way my path went. So like after the Hashimoto's thing, and kind of going through that journey, in 2020, my mom was diagnosed with ALS. And so if I'm sure you're familiar, but for those who aren't, it's Lou Gehrig's disease. It's a neurodegenerative disease, and essentially you lose your bodily functions. So for my mom, it was her swallowing and her speech first. And so she basically, within a few months, like couldn't talk. She had to get a tube in her stomach so that she could eat through her stomach. And she loved to like eat and drink, and that was like her thing. And so it was really hard as someone who loved her to see her go through this, and to see the support that, I mean, it's really sad the way that neurodegenerative disease patients kind of are shuffled through the healthcare system too. She was being seen at the Mayo Clinic, great clinic, and they do what they can, but it really, I think there's a lot missing in terms of like the palliative care side, the spirituality side, like if they want that. I think because it can be so scary going through a process like that where you lose your physical body, it's just you and your mind, you can't talk to anybody. And so without that, I mean, we all need this. I think this is one of the reasons why we're all so sick, is we're missing that spirituality piece.
yeah.
And so seeing how she went through that, and then also through that process, I found out I had a gene, an ALS risk gene too, so that my mom had. And I was postpartum at the time, that I just newly postpartum at the time I found out about this. And I actually started, and it was a time when I was working full time, pumping while I was seeing patients, like just push it, like the energy outflow was insane. Um, and so I ended up like 6 months postpartum getting symptoms of ALS, like straight up muscle twitching, started in my forearm, spread to like my entire body. I then, it's in your head. This was like for weeks that this was happening. I was like, okay, I'm getting it. You think you're weak, like you think you're getting weakness. And I believed that I had ALS, and I was like, well, shoot, I've got like 2 to 5 years left to be the mother to this, like my first child. Like this, it was just the most, that experience of thinking that I was going to, like, my daughter was going to have to see me like lose all of my function. She may not remember me. And then kind of my experience getting worked up for ALS, like getting the EMG, and kind of the physician saying, well, there's really nothing you can do. You don't have it. He said, I was like, thank goodness. I still believed I had it in my, I was like, I do. The EMG is just not picking it up. But But then him saying just like, there's nothing you can do, go live your life, which I actually do agree with. I respect that. Go live your life. Like, yes, because if you hold on to that diagnosis, or like that gene, you believe you become it. Like it will manifest. Clearly, it manifested itself through me. Like my nervous system was manifesting those symptoms. And so that was probably like that experience, the most growth I've ever had in my life. Because ultimately, you have to kind of surrender. And the functional medicine approach is always like, why? But actually, like, there's a limit to that. And sometimes you just need to surrender and listen to your body and understand what it's trying to tell you. It's trying to tell me, slow down, you know? And the spiritual growth that came from that, like being okay with dying, you know, when my daughter's young, and understanding that it's okay. Like, her life is not mine to own. You know, it's not, I don't own it. And it took so much time and it took like a year for those muscle twitches to go away. It took so much time to like really invest in my mental health. And that part of that was leaving my job, the job where I was seeing 25, 30 patients a day trying to do functional medicine. And what do you know, like after leaving that and spending more time for myself, slowing down, and the surrender, all of that was, what do you know, the muscle twitches went away. My nervous system calmed down. I like have more clarity than I've ever had. And I always think about that because I see a lot of patients in especially like the DC area who are really, they get really anxious about their symptoms and hyper focused on their symptoms. And ultimately, many times, most of the time, we're missing the spiritual support, the nervous system support. And so I think that that was like probably the biggest piece of my health journey that helped me. And I, you know, instill that in my practice too.
I love that. Yeah. I mean, the simple fact of slowing down, you know, allowing our nervous system that rest, like that's been a huge piece of what I've learned and that I'm trying to bring to the world too, because our culture is so like, it's almost like a prize. If you can, the more you can do, the more people you could see, you know, how fast you can get people in and out, how many things you can get done in a day. And as moms too, it's like, okay, I can do all the things. I can go to work, I can make all the food, I can have all the kid stuff, you know, situated. And it's almost like this prize, this badge of honor that we wear, that like, I can do it all and I don't need help. But then what does that cause inside of our body? What does that cause inside of our, you know, in our relationships, just in everything? Like that's kind of where I came from, where I was this stressed out, you know, where my husband told me one time, he's like, you are miserable. Like, you are miserable. We can feel it. Like, I don't like to be around you. The kids don't like to be around you. You are just, and that was a huge wake up call for me. Like, you're right. What am I doing? I am literally just going from A to Z every single day, trying to get all this stuff done for what?
Right.
You know?
Exactly. And the like, I think a lot of it too, it was like this self-imposed pressure that we create in our heads. Like it's really not there. It's like all in our minds. And like for me, it was also like feeling, because I was also, they paid us before on this production. So like the more patients you see, the more you get paid. And so you're like thinking, okay, for me, I was the breadwinner for the family. And so, okay, got to hustle, got to bring home like as much money as possible for my family. And like, no, like we don't need to make tons of money. Like we actually can live like where we're at right now is perfect, and we don't need more than this. And so just being grateful for every day and the way that it unfolds, and taking it slow, I think has been like a really powerful tool.
Yeah. And I think too, when you are aligned, like when it's your true authentic self, when you are living that, like how you've gone and adjusted and been like, nope, this is what I really want to do. Like when you have that, like you were saying, you have a practice that is thriving. It's just by word of mouth. Like when people see you in your power, in your authenticity, that's when you're going to have all those people flowing to you just because you are being your true authentic self. And people can feel that. And it just like it's this energy that comes off of you, and people are attracted to that, to your authentic self. Yeah.
Well said. Yes, I completely agree. Yeah.
Mhm.
That's amazing.
Yeah. So I'm sure you probably expanded on this in what we've talked about and stuff, but what do you feel is your soul's purpose?
I, um, my soul's purpose is, I truly think it's just to sit and be with folks as they're suffering. And so helping them, it's because I think we all know ultimately what's happening in our bodies. We all have the intuition to know what's happening in our bodies and why it's happening. And many times we don't need like fancy functional medicine tests, expensive tests to figure that out. And so being present for folks and guiding, having the time to really guide the conversation, to allow them to tap into their intuition about their bodies, to be empowered about their bodies, their minds, their soul, so that they're able to find healing and whatever that means for them. And I know we're not all like ever perfectly healed. It's always a work in progress, but for to shift the way that somebody looks at their own health journey, but in the most empowering way for them possible.
All right. So changing, kind of switching things up just a little bit here.
Mhm.
So now you're here, you're in Oregon, and you
Yep.
are have clients online and things. So how does life look now as maybe opposed to growing up? Like a lot of times we are born and raised to believe certain things, to think certain things, to act a certain way, to do. And so how does life maybe look a little different than what you thought it was supposed to look like, or maybe how you thought life was going to be like and now it is?
Yes. So it's a great question. So my mom, I love her. She, rest in peace, but she was a math teacher and very focused on math and science, like a STEM woman. And she kind of didn't she didn't want me to become like a teacher or a nurse. She wanted me to go do something different because from her perspective, she was very much a feminist too. So from her perspective, those were careers that you had to be as a female. And so she wanted, I think, something different for me because of her experience. So that was always kind of in my head. Like my first degree was a finance degree. I had got a master's in international business, and I was a consultant, and so it was very much like focused on money. And in my head, I think I rationalized that by saying, well, if you make a lot of money, then you can have the impact that you want to have financially on the world that way. So whatever that means, insert like philanthropy or something like that. And so that was how I saw myself kind of moving through the world, was to become like a very a person focused on finance and revenue generation. And I quickly, so I imagined myself at an office job, kind of being this successful business person. And I was on that path, working. I worked at this consulting firm, and I hated being at like a desk all day long, like looking at spreadsheets. And I am like my nervous system just like it was just my first job out of college was actually before I worked in consulting, was at a title company.
Mhm.
And it was my first experience ever just working at a desk all day. And I remember that first week I just sobbed. like every day after work. It was just, this is my life. I'm sitting at a desk for the rest of my life. Oh my goodness. And so that just I wish I would have done an internship. That would have been smart. But I immediately knew that that kind of wasn't for me, but I still tried to make it work. So I did that type of work, that consulting work until I was like 28, 29, like most of my 20s, I really pushed that. And it just wasn't, it didn't fit. It didn't feel right. I actually, one of the things that kind of opened me up to thinking about shifting careers out from like this more business approach to healthcare was also I started practicing yoga, and I got this trauma certified, trauma sensitive like yoga teacher certification. And I started teaching at this women's shelter in DC, and it was just the most wonderful group of women who had been through so much. They've been through hell. And here they were showing up and like doing chair yoga every Monday for half an hour. And I was like, oh my goodness, this is it. Like the impact is for me, like this is where I want my impact, one-to-one or a small group where you're there, you're with the people. And you are, again, it's like you getting out of the way and like kind of letting them work their way through it. And so that was kind of what got me thinking, oh, is that there's something here. And so I was kind of that my mind was more receptive before that whole bike accident thing happened. I was thinking about things I could do with other folks in person, but it just wasn't clear what that was. But the yoga teaching yoga really helped me open up my mind for that. And I'm so grateful. I love yoga. Yeah.
That's so cool. So do you still teach yoga now?
No, well, I did a yoga retreat in February, but I'm not teaching like a regular class right now, just with everything going on. But I would love to when things when things slow down a little bit more. And I feel like there's some time. I'd really miss it. But so in DC, I taught like almost every day. There's this really deep community in DC at this yoga studio called Yoga Districts. They had studios all over the city, and it was a wonderful place to teach. And so when I moved to Oregon, I kind of lost that and tried to start teaching, but then COVID happened, and it's just kind of been a little. It hasn't really fit yet, but I think I will in a few years.
Yeah.
Yeah.
So do you think that you did the financial plan or like went into that role because your mom wanted that for you? And like you were almost trying to like please your mom or
Yeah, like my brain didn't even consider nursing or teach. Like it wasn't even an option in my head. Like it wasn't even on the table. It was always, yeah, I think it was just the way that she, the way it was like framed in my mind from her. Yeah. And it's not that was based off of her experience. And so I think it was something she wanted for me. But I definitely, yeah, that just shows you, right, how much that has an impact on who you become.
Interesting, because when you did say that too, it's like it makes you think about, and I have kids of my own too. So then it's like, okay, even the little things that we say, and when we don't think maybe they've even paid attention to it or it wasn't that big of a deal, but those things are what they keep or they hold on to, and us as kids also, like it's shaped how we go, how we move, how we function in life, just by, how we were brought up, how we were raised. And I had the last podcast that I did, or maybe it wasn't the last one, but it was a couple of times ago. She and I were talking just about how we don't even realize what we are saying to our kids as they're growing up. Like, oh, it would be great if you did this, or it'd be great if you did this, or, like we're almost imposing our beliefs on them because, how we were brought up or shaped. Like, we don't want them to do those things. We don't want them to have those hardships, or we don't want them to experience that. But then what are we doing? Then we are also then putting our fears, our, beliefs and things on our kids. And so now they're going to grow up with these fears that we have that, that we thought we weren't passing on to them because we had healed that from our parents, so it's just like this, we try to do the best that we can, but there's still going to be those things that we give off just because of our own fears and insecurities in ourselves. So,
Yes,
yeah.
exactly. There's that quote from Carl Jung. Do you know what I'm talking about? He's that psychologist, and he said, kind of the greatest impact that a parent has on their child is what they never did.
Mm.
So he says it in a much more eloquent way, but it's exactly what you just articulated, and it's so true, and it's so, I think it just being aware of that. I don't even think my mom was, that was just because of her upbringing. She had a really rough upbringing with her mom. And so she was just all about like empowerment and, and so she was trying to pass on, based on what she went through. I got really lucky, getting all of the love that I got from her. But yeah, now it's like, we just kind of keep trying to do the best we can by generation by generation. Yeah.
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 So now you've talked about bringing in like the spirituality. You said it a couple times that we don't utilize that enough in our healthcare system, maybe even where you're at when you were a nurse practitioner.
Mhm.
In functional medicine, are you able to bring that forward in that? Because obviously it's your own practice, so you can do, what you want. So I don't know if you do bring that forward in what you're doing.
So yes, but I have to be sensitive and like aware of, it's like unique to each patient, because sometimes that word spirituality just
Yeah.
puts up the guard. And so
So is religion. So
yeah.
yeah.
Oh yeah, it's like a dirty word. And so I will try to go about it. I usually will start with just talking about the nervous system and like and use the nervous system and try to keep it like science based, for those types of folks. In my intake questionnaire, like one of the questions that I ask before I even see the patient is, do you feel like you have purpose in your life?
Mm.
Um, and do you feel like you have any perspective on what's happened in your health? And do you feel fulfilled at your, like based on your role in your life, whether that's at home or at work or both? Um, and so a lot of it, I ask the questions kind of in a roundabout way without saying things like spirituality, because a lot of folks, ultimately, if they are like really centered, grounded spiritually, it doesn't really matter at the end of the day, like what their job is or, what's going on with their kids, because they've always got that like that grounded, they're coming from that grounded place and they're connected with their spirit. Um, so there's something called, have you heard of brain retraining or limbic system retraining? Does that sound?
Heard of it, but I don't know much.
Yeah.
Yeah.
So I've been using that a lot lately for folks who aren't quite ready to kind of have talks about the spiritual aspect of things. But essentially it's using neuroplasticity and neuroscience to rewire the way that the limbic system, which is, where our amygdala is, where our fear center is, we really hold on to trauma there, to rewire the limbic system and how it connects and communicates to the parasympathetic nervous system, the vagus nerve, because we can do that. Like neuroplasticity does that. We can rewire the brain. And so a lot of that is using like there's somatic therapy. It's like kind of like a little program, somatic therapy. It could be things like tapping, or just like little gentle exercises to kind of do throughout the day to ground. But a lot of it's just recognizing, okay, I have a symptom that's present. Let's say it's like panic or something. I have a symptom that's present. And I understand why this is happening. My brain is trying to protect me. My nervous system is trying to protect me, and acknowledging that, doing some somatic work, and then saying, like doing something positive, like switching the script and like saying some positive affirmations, especially visualization. And so doing that again and again over time will actually shift that feedback loop. And that's so important for what I do with hormones, because the nervous system regulates hormone production, and our nervous system and our gut health are so closely, of course, intertwined. And so that piece is often missing. With folks, like if they've gone to a bunch of doctors or specialists or even functional medicine practitioners, a lot of times it's just missing. So that's so central to it. So if we can't do like talk about spirituality, we'll talk about that, like a brain retraining, making it more like, here's the neuroscience for this, and this is proven, and you can change your symptoms through neuroplasticity.
Yeah. Have you heard of Dr. Joe Dispenza? Yeah,
Yes.
so he's got a really great series. It's on Gaia. So I think you
Ooh,
have to pay for it.
okay.
But it's all about rewiring your nervous system, basically. It's super fascinating. Super
Hey.
fascinating.
Oh,
Yeah.
I've got to look into that. Okay, that's awesome. Yeah, so he's developed the heart math system, right?
Mhm.
So
Yeah.
yeah, where you're changing your heart rate it's yeah, like biofeedback, kind of changing heart rate and through like basically you're trying to align your heart rate variability with your breath. And I have the sensor. I tried it for a little bit. I really liked it.
That's
Yeah.
cool. Yeah, I don't
Mhm.
know much about that, but yeah, I did watch his rewiring. I think it was just called Rewired. I don't know. I'll have to find it.
Cool. I'm making a note of this. That's
Yeah.
great.
Yeah.
Yeah,
Yeah, it
love
was
it.
really good, really fascinating. There were some that I was like, okay, I got to come back to this because this was a lot. And yeah, yeah, it is a lot.
Yeah, it
It is
is.
a lot.
It has to be, yes, but things like that too. Yeah. It's got to be like a little bit
And
at a
he's
time.
so sciencey that,
Yeah.
sometimes I was like, okay, I get what he's saying, but it has kind of gone over my head a little bit, so I got to come back.
Yeah.
But yeah,
Yeah. I've really liked also talking about kind of like the spirituality piece. Have you heard of Michael Singer?
yes, the
Yeah.
Unwilling Soul.
Yeah, yes.
Yeah.
And the Surrender Experiment. He's got a great podcast. And I just love the way he'll say it's very much like he'll bring in religion, he'll pull from all religions in what he's doing. But it's not like stigmatizing. And it's very much like just it's going above like religion and more higher level in terms of a lot of like what he's teaching I used in my own journey too, just in terms of surrender. How do we like kind of approach surrender, train the mind to surrender? And I really loved his approach. So I will often recommend him just because he's not, super hard on any one religion. And it's more just like a higher level kind of spirituality and connecting with yourself, who you are, as opposed to yeah, like follow do this, routine this way every day, which it comes from everything. We have that in yoga, we have that in
Mhm.
all religion. And so it's nice to see that high level perspective on things.
Yeah, absolutely. I mean, I come from a strict religious background,
Okay.
so just learning about different different things, different ways that people might believe, that I mean, there's so many different religions out there. It's really kind of crazy to me.
Mm-hmm.
But really, ultimately, it's all seems to be very similar in an aspect too. Like really just yeah. So it's very
Sure.
interesting. Yeah. Yeah.
It's so true. It is similar because a lot of times it's telling the same stories, and it's a lot of the same like lessons. Yes, and that he's Michael Singer will talk about that, just like kind of like stories of the Buddha, stories of Jesus, and like how you can really learn just from what the Bible is trying to tell you, really more symbolically, which I had never heard. I grew up like going to like a Christian church, and uh, everything that we learned, I took like, oh, like it means what it says,
Yeah. I
and never
100%
really
do.
reflected on things, like took a step back and reflected, like, oh, they're really trying to say this, and so it's been interesting to kind of revisit that because I had kind of separated myself from that world for quite a while. And actually being in Southern Oregon where I'm at, there's a lot of religion here. And so I've kind of it's been an interesting process, kind of opening myself up to that again. And, being close friends with people who are very religious. And it's been a very good experience. Me pulling, getting rid of some of my old crap that I had, tangled up with religion.
Yeah, and I think that's a huge piece of it is the tangled up piece. I liked how you use that word because I grew up in like I said, in the church, but I went to school at the same place that I went to church. And so that was my life was basically all those friends. And then I did end up going to a different church after a while. But I didn't have people outside of so that's all that I knew. That's all that I knew. But it's like you learn it this way. This is the end all be all. You can't do anything else. You're gonna go to hell otherwise. And so when I became an adult, actually over the last like 3 years or so, I really was questioning like, well, what is all of this and how could it only be this way? And these are the only people that are going to go to heaven. And I don't know. So it was like untangling a lot of things. And now I'm at this place where I'm like, okay, I'm possibly ready to maybe talk about if we'd ever want to go back to church or, like looking into everything. But I really had to almost like unlearn all of this, everything that was told to me that was the absolute end all be all. And then really just be open to like, okay, God, what is it that you really have for me? And where is my purpose in all of this? Where is my place in all of this? And yeah, and I think it's different for everyone. And that's the thing that we can't judge. There's just so much judgment, I think, in religion, in the church. And I think then it just turns people off where they're like, I don't want to have anything to do with this. I don't want to have anything to do with Christianity because it is so judgmental. And I think
Yes.
I say this a lot in this podcast, I feel like, because that is a place that I come from. So that was, yeah, like a huge piece of wanting to do this is that just to show people that, there's other ways, there's other things. It doesn't have to be this end all be all, but like ultimately, if you believe in something and I believe in something, I can still love you and cheer for you. And it's not me being like, oh, you have to believe exactly what I believe and how I believe it. I just think that's where it gets so muddy and where people then are super turned off and
Yeah.
yeah.
So yeah, it's more of like a fear and control thing. And like, yeah, if you're a part of that system growing up, like we were, and then and then as you get older, you start to question things. And then the more you question, the more you really, like you said, you have to really kind of separate yourself from it, like align yourself with who you are and what you're wanting to learn and how you want to grow spiritually, and then like go back in with that awareness.
Mhm.
Which is it's like a lot. Yeah, it's a journey. And I also like I definitely went through a period. The judgment too was really strong in me when I was like anti-religion. And that's not healthy either.
Right.
That's not what I would want. And so yeah, relearning that and how it all fits with who I am. And there's still so much to learn, from religion, from these stories. And so, yeah, I'm really grateful for that experience and for being out here where I am and being in this community and learning from these folks and kind of how they've used religion too. It's pretty great. Yeah.
Yeah, it is. It's almost like a beautiful thing when you can come at it from this lens,
Yes.
where you're just open to whatever it is, instead of
Yes.
like how it had to be. It's almost like this fresh eyes, this fresh perspective, this fresh like, okay, let's look at this differently. Yeah.
Exactly. I
Mhm.
love that.
Yeah.
So
Yeah.
cool.
Well, thank you so much. This has been a really great conversation. Yeah.
Yeah.
And
This
so,
is wonderful.
yeah, is there anything that you would like to share with anybody listening here? Any last like parting words, any words of wisdom?
Um, Really that if you have chronic symptoms or you're on your own, we're all on our own health journeys. Understanding that mental, emotional, and spiritual piece is truly the foundation to healing. So, um, find yourself a provider who you can trust to talk about some of those things. If that's what you want to, if you're open and willing to talk about those things. Because that really will facilitate the healing process when you have somebody who listens and who you can trust, to have those types of conversations because it is so relevant to our health and healing.
Yeah.
Yeah.
I love that. Yeah. And so where can people find you?
I am. I'm on Instagram, Ashley Schrader, SHRADER _NP. So Ashley Schrader _NP. And I'm also on LinkedIn, big nerd. So you can find me on LinkedIn, just Google my name and it will come up LinkedIn. And then, on my website, which is risefxmed.com. There is, I'm actually doing a mass, like just an email series right now that is about learning about how to, like if you want to become more active or if you are an athlete, it's anywhere in that spectrum. I'm learning how to kind of navigate that journey while also going through hormonal change, or if you're struggling with chronic symptoms. And so it's a masterclass series, and if you just go to my website and sign up, you'll jump in and start receiving those emails, which are like jam-packed with information, evidence, links. Would love to have you join the conversation there too.
Yeah, awesome. And I'll make sure to put all of your links below so everybody can find you nice and easy and they don't have to remember or write down what you said. So
Wonderful.
yeah. Well, thank you so much for being here. It was such a wonderful conversation. So
fun. Thank you. Thanks for the grounding, the breath work, and kind of set the tone for my day. Thank you.
Yeah, you're welcome. Oh, thank you for listening to this episode. I hope you loved listening as much as I loved recording. Each and every conversation that I have here on this podcast just lights my soul on fire. I love having conversations where we explore and challenge our ways of thinking. So if you've resonated with anything here and you're looking for more, please connect with me on Facebook in my Soul Deep community group, which is free. I'm also offering all my listeners a free month in my Soul Deep Connection membership. I have poured my heart and soul into this membership, bringing you resources to help you grow into the best and truest version of yourself. I've used my knowledge and experience as a nurse, combined with my knowledge and experience as a coach, breathwork facilitator, and somatic embodiment guide. This library consists of breathwork, kriyas, and other resources and modalities that will help you learn about and give you the healing tools to live the life you've been dreaming about, and to help you find your true passion and zest for life again. This library of resources is vital for everyday maintenance. And on top of the library of resources, there are live monthly calls, ranging from breathwork, kundalini, full moon or new moon circles, as well as guest speakers on a variety of different topics, from decluttering to marketing to sisterhood and all things healing and wellness. So make sure you join today to get you back on track to living that thriving life that you are longing for. Remember, the first month is free, and my hope is that you find so much value that staying is an absolute no-brainer. It really is everything that I was looking for as I started my journey, and so much more. I truly hope to see you inside my community. And if you haven't yet, please follow me here and on social. Like and subscribe, and make sure to share your favorite episode with your friends and community. And when you do, make sure to tag me in that post. If you tag me, you'll be entered into a drawing for that month where you can win a free one-to-one session, breathwork or coaching session with me. All the links will be in the show notes here below. Until next time, Soul Deep fam, and in the words of my dear friend Mary Lacey Banks, I'm holding you so tight in a thought hug.